Everyone, well, it's noon. We're going to go ahead and get started. Thank you so much for joining us today. My name is Jody West. What we're going to do is we're going to go through our agenda, and just this is our timing of today's session so we can stay on track. We're going to do our best to stay within these moments and these minutes. We're going to do a brief round of introductions, and then Dr. Olivier is going to take over, and we're going to have our didactic presentation. And then we'll have our case presentation, and we'll have time to give input with recommendations and wrap up with announcements for our next session. We're grateful to have Bess Hart to present our didactic, and then Marissa Curl is going to do our case presentation. I'm going to introduce myself. I'm Jody West. I am the coordinator of the ECHO, but I am the program manager for the provider-to-provider consultation line. We provide mental health consultation around pediatric and perinatal mental health to providers across the state of Louisiana. It could be physicians, nurses, social workers, any professional that works with a child aged 0 to 21 or someone that is pregnant or 1 year postpartum and has a mental health concern. You can reach out and we can help with connection to a psychiatrist if there's a question about medication or diagnosis, but we can also assist with resources, therapies, and handouts, information, education, things such as that. So consultation is the bulk of what we do, but we also do trainings and education like our ECHO today. If you scan that QR code, it brings you to our website and you can get more information about all of the opportunities that PPCL can provide. And you can always reach out to us either through our phone number or email and ask us any questions that you might have. And we can assist you. So we appreciate all of you joining us today. I'm going to hand it over to Dr. Olivier, who's going to continue with the introductions to our hub team.
Hey, good afternoon, everybody. I hope y'all are doing well today, and thank you again for joining us. I'm Dr. Olivier. I was out last month due to illness, but I'm back. I'm one of the psychiatrists on the hub team. I'm here in Lafayette, Louisiana in private practice at Bloom Mental Wellness. And I'm going to quickly ask each of the hub team members to reintroduce themselves to everybody. There is another psychiatrist on the hub team, Dr. Finelli.
Thanks, Dr. Olivier. Hi, Juliana Finelli. I'm a general psychiatrist and child and adolescent psychiatrist. My focus is infant, early childhood, and perinatal mental health. And I serve as one of the perinatal psychiatric consultants for PPCL, and happy to be part of the hub team.
Thank you, Dr. Finelli. We have a few social workers on our team. You already met Jody. Katie, you want to introduce yourself?
Sure. Hey, everybody. My name is Katie Aber. I'm a licensed clinical social worker, and I'm also in private practice in Lafayette, Louisiana at Bloom Mental Wellness, where I see the perinatal population, and I volunteer for Postpartum Support International as well.
Thank you, Katie. And how about Lena?
Hi, everybody. My name is Lena Reguette. I'm one of the mental health consultants for PPCL, and also help kind of facilitate and do IT for this ECHO.
Thank you, Lena. We also have a nurse/psychologist on our team too, Dr. Zena. I don't see her on the call yet, but she might be joining us in a little bit. But that is your hub team of experts for this session. I'm also the facilitator of this session, so I'll be trying to keep us on time. And so for the next 20 minutes, we're going to turn it over to Bess Hart, who has graciously offered to present our didactic today. So Bess, you can go ahead and unmute yourself and take over.
You bet. Hi. Good to see you all. Those of you that I know, nice to meet some of you. My name is Bess Hart. I have been trained as a social worker, and I'm currently working mostly as a doula in private practice. And I also specialize in perinatal mental health. And so I work with a lot of families that are pregnant and postpartum, oftentimes because there's some sort of complication that's arising in either the fertility process, the pregnancy, or postpartum period. So I'm excited today to talk about mental health of non-birthing partners because I don't get a lot of opportunity to talk about this. And it's always sort of something that I'm really interested in. And I imagine many of you are very interested in as well, working with birthing parents and new parents, because we often don't see a lot of partners presenting for care. Go ahead and advance the slide. So I think it's really important for us to talk about the mental health of non-birthing partners. There's in this presentation, it's a little complicated. There's so many different ways that people present as partners and caregivers, and there's not a lot of research except primarily on either fathers or adoptive parents. But there's not as much research on same-sex couples and other sorts of caregivers in the family. So I'm going to try and extrapolate and give information on like how attachment is formed and how mental health might affect any sort of caregiver in the family system. Um, Research says that about 10 to 15% of dads in more traditional nuclear families report experiences of postpartum depression or anxiety. But we think this is pretty under-recognized, that it's underreported and underdiagnosed. So there's a lot of resources that suggest it's about 25% or so of non-birthing partners that are experiencing some sort of perinatal mood and anxiety disorders. And why this is so important is that the mental health of both partners, the non-birthing parent, is so deeply connected with the well-being of the birthing parent, the infant, and the overall family system. Go ahead and advance the slides. So just some statistics on perinatal mental health overview. About 80% of birthing parents experience the blues. About 25% of birthing parents experience a diagnosable perinatal mood and anxiety disorder, although also there's a lot of research that is much higher as well. Like I said, about 10 to 25% of non-birthing parents experience perinatal mood and anxiety disorders. And we see that this is much more common in lower socioeconomic classes and with people of color. So it's about 11 times more likely in folks that have a low socioeconomic status, and about 4 times more likely to be seen and diagnosed in people of color. Go ahead. So I just want to talk about language for a minute. I'm using the term non-birthing parent. I wanted to just introduce some more neutral and inclusive terms that we can be using in our work. I always think in teaching and when meeting a new family, it's really important to lead with more inclusive language. So some alternatives are birthing parent versus mom, partner or non-birthing parent versus dad, because we don't know in family situation, there may not be a dad, there may be another female partner. We don't know if the partners are identifying as female or male. So this really just gives a much more safe, inclusive space. And once families talk to me about their language and how they identify themselves, I adopt whatever language they're using to identify their family system. Go ahead. So just a couple definitions that I wanted to share as we're getting started. Non-birthing partner is a term that's used to encompass both male and female partners and co-parents who are variably biologically or non-biologically related to the child. Because this encompasses families that use fertility methods. They may use donor sperm, donor eggs. You may have step parents, a boyfriend, girlfriend, like there's all kinds of family systems. So that's what we're referring to as whoever is the partner, the non-birthing partner. Alloparenting is a term that you may or may not be familiar with, but this is an encompassing term for anybody who is giving parental care towards young that are not their own offspring. So often this includes adoptive parents or extended family and caregivers. So a non-birthing partner could be considered an alloparent. We usually give them their own designation of being a partner or a parent because they're in kind of like that primary caregiving role. And alloparenting often extends sort of like beyond the primary caregivers of the child. Go ahead. So as we're thinking about who might experience more difficulty with attachment and parenting and perinatal mood and anxiety disorders, cultural considerations matter a lot. It's really important for us to think about the fact that people of color are 2 to 4 times more likely to experience these disorders. They're much more likely to have underreported symptoms, often because of systemic racism, fear of the medical system. There's often not equal access to medical care and social supports. So it's just really important for us to consider that as we're thinking about sometimes the strengths and vulnerabilities that families have in this perinatal period. Go ahead. So let's look at some of the statistics and information specifically on postpartum depression in men. So the research that we have suggests that about 10% of dads suffer from postpartum depression, which is kind of like often used as that catch-all for mood and anxiety disorders. What's really interesting, and I think is probably one of the important takeaways from today, is about 50% of men who are living with a partner who is experiencing perinatal mood and anxiety disorders will also experience that. So this is one of the primary indicators and factors, is when you have a family system that is experiencing perinatal mood and anxiety disorders, it becomes far more likely for that non-birthing parent to also experience those symptoms as well. First-time parents and first-time dads tend to be more at risk. Dads sometimes present a little bit differently with more aggressive, irritable symptom presentation. It tends to be a little bit more prevalent today, we think, because dads are more involved with raising children, and not just dads, but we have more of like this nuclear family system, right, where we often have just 2 parents in the home as well. I'm going to talk about some of the hormones in just a minute. One thing I think that's also really interesting is we're often looking for symptoms in birthing parents right after birth in those first few months. But the rates of postpartum anxiety and depression in men actually tend to go up 3 to 6 months after birth. So some of the thoughts around that might be that if mom was home for a maternity leave, there's a big shift in the family again, and a big shift in caregiving responsibilities as the primary caregiver may be returning to work, or they may not be exclusively breastfeeding anymore. And so again, there's like a big shift in responsibilities in caregiving. And so oftentimes that can be sort of like a delayed experience for men. I sort of like informally always talk about in my office with families, trying to help them understand that like sometimes mom is like 6 to 9 months sort of like ahead in this attachment and caregiving role and responsibilities, and that like dad is learning and attaching to this experience at a little bit later of a rate. Let's see. Okay, I think that's it. Go ahead. So I just want to look at some of the causes and risk factors. These are all the same in both birthing parents and non-birthing parents. So the more sort of biological predisposition, social predisposition, as well as the environmental factors specifically around getting pregnant, the pregnancy, the health of the pregnancy, are typically the risk factors that would be associated with mood and anxiety disorders in non-birthing parents. I won't go through all of these because I think y'all are probably pretty familiar. I did just want to mention, I did not put this in my slides, but there is a really great tool that I use with families all the time. Postpartum Support International has published a discussion tool. And if somebody can maybe throw it in the chat for me now, that would be great. But it'll also go up with the slides as well. But this has a symptom checklist, but also has a risk factor checklist. And so this can be used with physicians. It can also be used in your office. I think it's a really great way to help families really understand what their risk factors are. Because when we're looking and working with a family that has lots of risk factors, I like to talk to them about, like, that's okay, that makes sense. We just need to put more protective factors in place when that's the case. And so I think it gives them a better sense of like how to take care of themselves in the family system as they're progressing through pregnancy and infant care. So that's something I use all the time. It's in English and Spanish and free and easy to find on the PSI website. Go ahead. So I wanted to go into just briefly some of the biological effects of caregiving that we know, because I think this is some of the most interesting data that really helps us understand that it's not just about who is biologically the parent, but really we see effects of caregiving in any type of caregiver. And the more caregiving that you're doing, the more likely you are to have bigger changes in your physiological and hormonal system. So in men, there is seen up to a 30% drop in testosterone in new fathers as compared to men without children. And this is associated with increased paternal caregiving and emotional attunement. Additionally, you see a modest increase in estrogen in non-birthing parents who are spending more time with newborns. And the purpose of this is to enhance bonding and nurturing behaviors. And you also see an increase in cortisol levels postpartum in both birthing and non-birthing parents. And the biological purpose of this is to increase alertness and attunement to the infant who is in distress. And also what's really interesting is that cortisol levels tend to synchronize between partners, which correlates to that data we were saying that if one partner has a perinatal mood and anxiety disorder, it's very likely that the other will. So I think it's really interesting and important to point out that the biological shifts are shown in non-birthing partners, and these are made so that we're wired to bond and care with our infants. Go ahead. A few more. Oxytocin. Studies show a significant increase in oxytocin in all caregivers with the holding of baby, with skin-to-skin contact, looking in the baby's face, and responding to their crying. Gray matter changes are seen in all alloparents, and this is associated with regions of empathy, emotional regulation, and decision-making. And the dopamine reward system is activated across genders with infant care, reactions to their facial expressions, smell, cry, and it gets stronger the more time caregivers spend with a child. So all of this really indicates that this isn't about whether you're born male or female, or you're the birthing parent or non-birthing parent, but it's really associated to the caregiving of that infant and how much time you spend with them. Caregiving causes neurobiological changes in all humans who take on caregiving roles. Go ahead. So some of you are probably familiar with this term matrescence, and very informally, I like to talk about putrescence as well. I don't know about any research or publications on the term putrescence, but what we're talking about here is the physical, social, spiritual, emotional shifts into fatherhood, parenthood. This is a huge shift. We just went through physiologically the shifts in what the body is doing. And think about all of the shifts that are happening in people's lives as well. It makes a lot of sense that people are experiencing fluctuating moods, fluctuating hormones. They're really trying to figure out their sense of self and identity as a family. So all of the things that are shifting include well, well, I guess the things that might be shifting that are contributing to perinatal mood and anxiety disorders here are potentially lack of social supports in a nuclear family structure. There's a lot of really interesting writing and research these days that kind of suggests that is postpartum depression really a disease of our modern society? The fact that we are under-resourced as new parents, isolated as new parents. There's a lot of lack of structure of community supports, especially for non-birthing parents. A lot of parents don't have paternal leave. There are less dads groups out there. I think there's also a lot of like emotional and social stigma and barriers to non-birthing parents engaging in those groups as well. There's a lack of social role models of active fathering. A lot of non-birthing parents feel sidelined in the birth and recovery, that especially in our medical models, dads and non-birthing partners really aren't included at all in that dyadic model. There's a lack of role models in emotional sharing. A lot of men and partners might experience more stoicism, emotional suppression, or have cultural expectations on how they express their emotion and experience of caregiving. And then there's a lot of changes in the relationships dynamic when a new baby comes into the family, less intimacy and less communication. Okay, go ahead. I'll read a couple quotes from dads just to get a sense of what the experience is for dads. Men are expected to be big and strong and stoic, take care of everything, to be a tough guy. It was hard to acknowledge that I needed help. I don't feel I can tell my wife about these feelings. It will make me look weak. I hate my baby's crying, his needs, his endless discontent. Go ahead. These are some quotes from parents, non-birthing parents who have a partner who is experiencing a significant perinatal mood or anxiety disorder. So I was at the emergency room and I was overcome with feelings of loss, and I cried for the first time in many years. It felt like the life we had built together was falling apart. I felt very frustrated because it seemed like there was nothing I could do to help, and I wasn't able to help with feeding, and I also couldn't convince my wife that the baby was fine. There can be a real sense of helplessness that can be part of that anxiety or depression that's presenting. Okay, go ahead, just in the interest of time. Some common feelings that men in particular, fathers, discuss when experiencing anxiety and depression. They use these words: invisible, overwhelmed, forgotten, excluded, helpless, trapped, confused, inadequate. Go ahead. Okay, so let's talk about support and solutions. I'll try to go through this quickly in the interest of time. Go ahead. First, let's just briefly talk about assessment. Really important to always be assessing both parents in the family system, or all the parents in the family system, all the caregivers. There's a lot of non-birthing parents who report saying, nobody asked me how I was doing. I also think it's really important. Don't just ask once, ask again. I really introduce with families that, like, it's okay. It's okay for you to have feelings. There's space for that here. It's not just all about mom or the birthing parent. Research indicates that you can use the EDPS to screen in partners, that actually we should just lower our threshold a little bit because they're less likely to report as much. They kind of underreport. So there's a bit lower threshold, but it still has some accuracy. Go ahead. So a treatment model for non-birthing partners looks very similar to that for birthing parents: needing adequate sleep, nutrition, and exercise, practical and emotional support, perinatal education, therapy or counseling, and medication. Go ahead. I'm going to give some examples here about what those all might look like. So as a social worker and as a doula, it's really great to be able to work with families and give a lot of this psychoeducation and really break it down for families. What do we mean when we say get sleep? What do we mean when we say sleep with the baby sleeps? So I talk to people about what does practical support look like? So realistically, small things. Ask somebody to come over and hold the baby for 2 hours. Not can you think helping them think through like these small tangible things that they really can do? Is there somebody that you can ask in your family to bring you a meal once a week for the next 6 weeks? Is there somebody you feel comfortable with asking when they come over, can they wash and fold the laundry while we're visiting? Just to do those things to help practically around the family system. I did see I have one typo in this here, adequate sleep part. I define that for families within the first 3 weeks. For the birthing parent, we define that as 2 3-hour stretches as a bare minimum. Often partners tend to get a bit more because they're not exclusively breastfeeding, but not always. And then after that, after the first 3 weeks, we define that as one uninterrupted 6-hour stretch. So both parents, birthing and non-birthing, those are going to be our primary goals in this acute postpartum period. Therapy and medication. I do recommend that people look for someone who is well-versed in the perinatal period. You can search at postpartum.net for providers in your area. I also think another really helpful way to get partners involved is to do some couples therapy, because often this is the only way I can get the non-birthing parent to come in around this perinatal period. And there's lots of other like non-therapy, but father-focused recreational or therapeutic groups. Go ahead. I think psychoeducation can be one of like our easiest interventions that I think is often overlooked, is like really making sure that the partner is involved in the birth prep and the prep for the postpartum period and infant care. Really understanding what the expectations are, I think would go a long way in the overall family system, and kind of alleviating some of the stress of these changes during that time. Given our time, I'm not going to go through all this. I'm just going to plug the book, What About Us by Karen Kleinman. This is one I recommend to all of my birthing and non-birthing partners. She does a really great job of illustrating scenes between couples and kind of what they might be thinking and not expressing in those moments. Go ahead. So we know that healthy partnership leads to better infant outcomes, emotional regulation, and attachment. So we're really not just talking about dad's mental health or partner's mental health, but we're talking also about the birthing parent and the infant. Go ahead. And just some concrete resources for you. You can switch to the next one. Postpartum Support International, I think this is the first go-to for families. They have a page for dads and for LGBTQ partners. They have support groups monthly, specifically for dads or for gay or lesbian parents. So there's several things at PSI. And then go ahead and switch to the next. And here's a few more resources for dads that I put on here. In New Orleans, there's a group called Fathers Matter. There's several dad groups online here. There's another book, The Postpartum Husband by Karen Kleinman. She's one of our go-tos. And a couple podcast episodes that might be just a small bite for partners to listen to as well. Okay, so that's it for me. I'm happy to take questions if there's time for that. I'll kind of hand it over to y'all to decide what to.
Thank you, Bess. We are a little bit over time, so I'm going to ask everyone to hold their questions to the end. But thank you so much. I really appreciate you presenting.
Just to wrap up, everybody, we have the survey for CEUs. You don't have to enter your information in it for attendance anymore in the chat, but you should have a survey in the link, but we'll also link in the chat, excuse me, but we'll also send out the survey as well as the recommendations for the case and the slides from Bess's presentation. I'll send an email today or tomorrow. So thanks to Bess and thanks to Marissa for the information today. It was a great discussion. Our next session will be on the 24th. We do need a case presenter. If you have a case that you'd like to get everyone's feedback for, oh man, my screen keeps acting funny. I'm sorry about that. But our next topic is, I can't even see it.
Lactation and breastfeeding and the impacts on perinatal
Thank
mental.
you so much. Lactation and breastfeeding and the impact on perinatal mental health. That's our next session. So thanks everybody. We appreciate it. Reach out if you have a case you'd like to present, and we'll send an email out with all of that information. Everybody have a great day. Thank you so much.
Thank you.
Thank you.